Hello everyone. On this occasion, we will present a video. It's about the how to use the inhaler. But the first, let we introduce ourselves. My name is Gilbert Prawiratama. The last ID is 130.
My name is Nur Amin Zakaria. The last number is 006.
My name is Egalita Adliyah. The last name 114.
My name is Kanaya Shabrina. The last ID 24.
Okay, let's check it out and video.
Sister Ashley, come please. Good morning, sir and yes. It is Ashley.
Yeah,
What do you have complaint today?
I have been having shortness of breath more often, about 3 to 4 times a day. Also, frequently at night, and the inhaler I use doesn't seem too much anymore.
That's right, sir. My child has asthma that since the childhood, but now it's getting worse than usually. We're worried.
Alright, sir. I will not done the complaint. Let me check your vital sign first.
Okay.
The data is your blood pressure is 120 per 80 and your pulse is 92 beats per minute. Your respiration rate is 22 and your body temperature is 30.8 degrees. Oxygen respiration is 95% without additional oxygen. Alright, sir. The data is complete. Please wait a moment and I call the Dr. Kanaya right this.
Okay, sir. Thank you for the checking. We will wait for the Dr. Kanaya.
Hello, good morning, Pak Anto and Mr. Surya.
Good morning.
Please be seated. I can feel the nurse. May I ask you more questions?
Every day, doctor, sometime 4 to 6 times a day.
I want to know first, but how will you use salbutamol? Do you use it every day?
I used to do it when shortness of breath, doctor, not every day.
Okay, well, that one actually has to be used routinely every day, even if you're not feeling consistent.
Oh, like that. We think that all inhalers have the same use. If you have short breath, you just use it, and don't have short breath, you don't use it.
That's something that's often misunderstood, sir. So I'll explain later, okay?
Okay.
Okay, I believe from the way you use your inhaler and the frequency with which you use it, I see several problems. First, you are using salbutamol too often. Even salt is used only in the need for acute attacks. If you use it continuously, your body can develop a tolerance and you could experience tremors or heart palpitations. Furthermore, you are not using your control medication. Budesonide and formaldehyd as they are supposed to prevent attacks.
I thought the person was saying that shortness of breath is okay.
That's the main problem. Asthma attacks will continue if the inflammation in the airways is not treated. Meanwhile, controlled medication is what works to reduce the inflammation. When you say you took a big breath after pressing the inhaler and it holds your breath afterward,
Yes, that's how to do it.
that prevents the medication from reaching the lungs optimally. And you also rinse your mouth after using the steroid medication, which increases the risk of a fungal infection in your mouth. Okay, looking at the overall situation, the reason why your asthma is uncontrolled are your dependence on salbutamol inhaler technically. Failure to take your controller medication regularly and lack of regular monitoring.
Oh, like that. So it's not the actually the asthma is getting worse, but the wrong use of the inhaler. That.
That's right. Asthma can be managed very well if treated correctly and regularly.
Oh, okay. Thank you for your explanation.
Okay, so here is Egalita. Starting today, you must use your Barisone for water inhaler twice a day, morning and night. That's your controller medication. If it's work, we can then use the smart method, which involves using the same inhaler regularly and during an attack. But for now, let's work on your technically and complications. For salbutamol, only use it if you're short of breath. Don't use it every day, let alone multiple times. If you need to use it for more than 2 consecutive days, it means your control medication needs to be evaluated.
Okay, doctor, we'll do that.
We will also add a sponsor to your inhaler so the medication can reach your lungs more effectively.
Alright, Mr. Gilbert Adliyah. Now I will teach you the correct inhaler technique. The first step is hold the inhaler like this. The next step is you need to shake the inhaler, and after next step, exhale slowly in inhaler.
Okay.
Then put the one piece into your mouth.
Okay.
Exhale, inhale to slowly and deeply. After that, hold your breath for about 10 seconds before exhaling slowly.
So that will help with me.
Yes, Mr. Edwin and Mr. Gilbert, medication make mistake there if it's too fast. The medicine does have time to put it into the airway, and if you later use steroid medicine, remember to reach your mouth afterward.
Okay, sir. Thank you for your explanation.
Mr. Medis, Edwin also avoid to asthmatic. He has a history of allergic to dust and cat fur. So it's the best to avoid them. Avoid restaurant and avoid spirits mouth. If it is cold, try wearing a mask or noise covering.
Okay, Mister. Until now, from now, we will try to keep our home keep clean from the dust and the others.
Well, we monitor severity. How often you experience shortness of breath each week? How often you use salbutamol, and whether you started experience side effects like tremor or oral thrush. And if check up your inhaler technique, short be request. I want you to come back in 1 and 2 weeks. We'll see if your asthma attack are starting to subside. If you have shortness of breath, then those improve in 1 to 2 days. Or if you have to take salbutamol repeatedly, or if you feel your heart racing, come back because your schedule back up.
Okay, I will in mind.
Okay, Mister. Thank you. I think we will come back from 2 weeks or 3 weeks then to control the acute asthma. So, thank you for your control today.
Thank you.